critically about what I wanted to do um, for real, for real. And one of my colleagues that was in the program that I was in a research program for minority students, and she was doing public health research, and it was very human focus and change focus. And I thought that was the most interesting thing because I had never had any experience to non like biomedical sciences type of research. And I was a little bit interested, but I never really did anything about it. I told my physics professor that I don't think I wanted to go to med school anymore. It just wasn't resonating with me like it did when I was a little girl. um, and I told her I wanted to be able to change systems instead of, you know, I wanted to be an OBGYN and I wanted to help underrepresented and under-resourced young women. And I felt like, okay, I can provide this care to the people in need, but if their environments aren't changing, they're going to go back into an environment that's not conducive to their success. And they may end up back in the same situations that they were in. And so I wanted to effect change on a more systemic level instead of just kind of fixing people up and providing care in that way. And so I told my physics professor that Dr. Tennille Presley, and she brought up public health to me. And she explained to me like there's different concentrations and focus areas in public health. And I was like, I've never heard of this ever. Um, so I did some research and I found out about community and maternal health. And I was like, this directly aligns with my passion for like helping pregnant people. So I applied literally my last semester of undergrad. I just randomly applied to a bunch of schools that had those programs. And I got in and I went to get my master's in public health. And through that master's program, it opened up the floodgates for DEI for me. It was mainly health equity. And I just learned a lot about behavioral change and the change management process and how equity really is important for not just people who are marginalized, but for everybody. Like everyone needs equitable access to resources so that they can live a healthy life and have healthy life outcomes. And so I got my master's and I took another left turn and went into accreditation. And so for a while, I worked to accredit public health schools and programs across North America. And in that role, I got even more introduced into DEI specifically because I worked to help develop cultural competency accreditation standards and also worked with the heads of the programs in the schools to make sure that their research endeavors, their hiring practices, and their retention practices and how they interact with their student population was diverse, equitable, and inclusive. And through that role, I learned about like climate assessments, which is what we in the DEI space call like DEI audits. And so that kind of gave me the foot in the door to really get deep into DEI.